also known as epinephrine, is a sympathomimetic agent, also known as an adrenergic agent. It's classified along with norepinephrine in a group of their own, and that classification is marked by effects on blood pressure and heart rate along with other effects. Some short-term effects of adrenaline release in the body include increased blood flow to core organs and muscles, fight or flight mode in the sympathetic nervous system, bronchial dilation, faster heartbeat, and increased blood pressure. Long-term effects are very rare, and they're primarily due to chronic stress or disease. They include increased risk of heart attack or stroke, anxiety, headache, weight gain, or insomnia, damage to blood vessels, and increased blood pressure. Adrenaline release in the body is stimulated by the sympathetic nervous system. It's a stress response directed by the hypothalamus. Adrenaline is released and regulated by the adrenal medulla, and it stops when the stressful stimulation ends because nerve impulses to the adrenal glands are lowered, resulting in decreased stimuli. The adrenal gland location is on top of the kidneys in the suprarenal glands. The adrenal medulla secretes both epinephrine and norepinephrine. A stressful event sends a message to the spinal cord, which sends a message to the preganglionic sympathetic fibers, resulting in the adrenal medulla stimulation and catecholamine release from the adrenal glands, which is 80% adrenaline, 20% norepinephrine. Adrenaline absorption in the body is able to combine to alpha 1 and 2 and beta 1 and 2 and 3 receptors in many organs. The effect is dependent on the cell type and organ function. It tends to have an all or nothing effect due to the flooding nature of its release. It can be stopped in one of four ways. It can be broken down by catechol-O-methyltransferase, or monoamine oxidase. It can be reuptaken into nerve endings, or it can be diffused from the active sites. A common cause of adrenaline excess in the body is from a kidney tumor called a pheochromocytoma. It puts the body into a highly stressful state, like fight or flight mode regardless of the surroundings. Its symptoms include rapid heartbeat, nervousness, high blood sugar, and increased metabolism. Adrenaline deficiency in the body is very rare, although it can occur in certain genetic catecholamine enzyme deficiencies. Symptoms of adrenaline insufficiency are anxiety, depression, low blood sugar, changes in blood pressure, and changes in heart rate. Even for people who have lost their entire adrenal gland, norepinephrine can be converted into epinephrine. Norepinephrine is produced in the peripheral nervous system and is not dependent on the presence of an adrenal gland. Some age-related changes that can affect adrenaline release in the body include the amount of adrenaline production decreases drastically with age, but the plasma concentrations remain constant because adrenaline clearance in the blood is also slowed in older adults.